Welcome back to our cranial cruciate ligament series. I'm Dr. Laurie McCauley with Optimum Pet Vitality, and today we're going to be talking about eliminating some of the warning signs we talked about previously. So we're going to go through if you have found effusion, crepitus, changes in range of motion of the patella, pain on drawer or thrust, changes in posture, and atrophy. So if we have effusion, we can use PEMF, pulse electromagnetic field therapy. There are loops, there are beds. This is a respond bed. It works really well for decreasing inflammation, which is good. When I laser a patient, I have my clients feel the effusion so they know what the problem is. We laser it and it is gone, or 90 to 95% gone by the time we're done lasering. In fact, I would say about 50% of my clients own their own laser, and I help them use it so they don't have to see me as frequently. The other thing is they can tell me, they call me up, hey, Doc Laurie, we have an issue. I've got effusion and I can't get rid of it. We need more. Okay, come on in. Great time to bring them in. So great clients can figure out how to treat their dog with your veterinarian's help and know that they can either purchase a laser, or if that's not in the budget, they can rent a laser. Respond and SpectraVet both have programs where they can either rent or purchase a laser as a pet parent. And it's a wonderful thing for them to have at home, to be whether they need to treat a knee, a hip, again, as long as they know what they're doing. Okay, you found crepitus. Now what do? The first thing we need to do is get them on some kind of chondroprotectant if they're not on it already. And there's lots of really good ones. One of the people I dearly respect, Leilani Alvarez, gave a great presentation looking at a meta-analysis. Basically research looking at lots and lots of research. And what it found was that the supplements that had green-lit muscles in them, not just the isolated glucosamine and chondroitin, had really good results. And the products that had just isolated glucosamine and chondroitin in them, not the whole animal and all the coenzymes and stuff, they didn't have such great results. So my recommendation is to find a product, and there's lots of them out there, good ones, that have green-lit muscles in them. And make sure they have enough to have an effect. I also recommend canine musculoskeletal support from Standard Process. They have great products, and this one specifically helps support tendons and ligaments so that we're less likely to have a tear. And if we have crepitus and we don't get rid of it, that really sensitive stuff, within 12 weeks, that's my rule, then we get them on adequate, right? So polyglycosaminoglycans. It's the only thing that we know of that has been shown to be disease modifying, so actually rebuild the cartilage. It's a good thing. If we have lack of patella motion, so we've taken our knee, we've put it in full extension, we've said, can we move it left to right? Can we move it in both diagonals? We pick a position and we go to move it and it doesn't move. What do? In that extended position, we're going to gently oscillate it so that we can get some motion. Think about scar tissue like Elmer's glue. Remember when you're a kid and you like glue things and it's like stuck together, but then you can break it apart. You're not going to tear a tendon or ligament with just a couple ounces of pressure. You can break up scar tissue if you're going in the right direction and you're just oscillating gently, always within the comfort level of the dog. You break that up and all of a sudden that patella that was grinding on the side is now sitting in the middle, gliding where it's supposed to be, decreasing inflammation, building in that joint. It's a wonderful thing. We always then flex it and extend it, make sure that it's moving nice, and reassess it frequently. In the beginning, you might do it daily. Is it okay? Is it moving? And then weekly, and then maybe monthly. And if you're not having a problem, yay. But now you know what to do. Pain. Remember, just because they don't have pain on flexion and extension does not mean there's not pain when they're standing. When they're standing, gravity is a big force. It's pushing down on them, right? And sometimes when they go to walk, there's getting some shear force in there, or run, or they're running and there's a lot more pressure. The faster they go, the more peak vertical force that's going into that joint, into that meniscus, into that femur on tibia. So just because they don't have pain this way doesn't mean they don't have pain this way. We always want to get rid of pain. And you may have pain on flexion and extension or drawer or thrust, any of those things. We want to make sure we can make it go away. You may see it as their pelvis is higher than their withers. You may see that as picking up a foot, and they don't want you to pick up the foot that is supporting their weight. How do we get rid of it? We can do cryotherapy, right? Cold, ice. Anytime you have active inflammation, ice is wonderful, right? Rest and elevate and use some ice. That's great. We can laser when there's pain. We should be able to get rid of the pain with the laser. We can use PEMF. Again, there's loops, there's beds, both of which are great at helping decrease inflammation and pain. And when that's not enough, there's drugs, right? I'm not against drugs. Better living through chemistry, babe. Once we get rid of the pain, then we want to get off as soon as possible. But certainly we need to get rid of the pain. And as the video showed you, I'll play it again, we can do traction, stabilizing above the knee and just gently pulling that tibia down, stretches that joint capsule. Let's see if we can show you. Here you go. There's the knee, there's my patella. I stabilize above and just pull. It stretches that joint capsule. There are nociceptive fibers, so pain fibers inside the knee that it triggers to get rid of pain. As well as by stretching it. There's studies, it's great, that show that just by tractioning, you increase the ability to flex and extend, bend and straighten if it was restricted. That's really cool. The next thing we're going to talk about is sitting, right? We're going to change the posture. No more puppy sits. We want nice square sits. So if you have a puppy and he's sitting to one side and then the other, by the time he's 6 months old, that is gone. And if it's not, we don't want to have him have abnormal biomechanics that every time he gets up, he's putting stress on his knees. They're rocking in, they're rocking out, putting pressure in different places, shear force, all of that stuff. So we train him. We create a new normal for him. This is how you sit. This is how you get up. This is how you stand. This is how you lay down. So that they know if I say sit, it is not going to be down, right? Because if they're on their butt, they're going to have back issues. They're going to have knee issues. They're going to overuse their front end, so then they can have carpal issues. We don't want to go there. Fix it when they're a baby. Or, again, 6 months old, right? Let the puppy be the puppy. But by 6 months, they should be able to sit properly. Atrophy. There's a great study looking at myos, which has fortitropin in it, that shows that that substance decreases myostatin. Myostatin is a chemical in your body that's released when there's an injury or as you get older that stops you from being able to produce muscle. This actually stops the myostatin and allows you to build muscle. Study looking at TPLOs. They had a cheese substitute as a placebo or the actual myostatin, the myos. And what they found was that the dogs that had a TPLO and had the cheese, they atrophied. It's what you expect. But the dogs that had the myos, they had either no atrophy or very little atrophy. That's cool. They are vet formula. They have amino acids in them, the ones specifically that can help muscles. The other thing I recommend is collagen. Collagen can help rebuild the cartilage. It's giving the body the building blocks. So you want a collagen that has lots and lots. I think the one I take has like 20 different amino acids in it. So it's good stuff. Exercise. This is an amazing exercise. I designed the Octaboard for this. You have one limb off. The other 3 legs are on an unstable surface. You move the board. The only limb that can help stabilize the dog is the one that's on the ground. So without any shear force, without any extra compression, we are strengthening all the muscles that are going to help stabilize that knee and hock and hip on that one leg. This is specifically for when you have one leg that you want to strengthen. It's a great, great exercise. Cavaletti pulls. Cavalettis are great. Again, these are Cavaletti jacks. I designed them. I love them. You can get them on our website. Both the Octaboard and the Cavaletti jacks. These can be 2-inch, 4-inch, 6-inch, 8-inch, or 11-inch. They can go under them. They can go over them. When they do this, They can have it at stride length where they are working on, I have all my weight on this leg, all my weight on this leg. So you're on weight shifting, weight bearing, so they're not doing this thing. And as we raise them high enough, they're working on the muscle specifically that helps stabilize the knee. They help strengthen the quadriceps and the sartorius in the front and the gastrocnemius in the back. So we're decreasing the chance of having that laxity that's going to put pressure on and then tear the CCL. Another great exercise that I recommend puppies, adults, geriatrics is rhythmic stabilization. This is where we ask the dog to stand square and we put pressure at the hip, at the chest, at the shoulder. And as we push in, they stay and they're pushing back and they're working on the stabilizer muscles, specifically the ones that are going to help get the whole body, the trunk, stabilize the shoulder, the elbow, the wrist, the hip, the knee, the hock, everything. It's a great, great exercise. All right, I hope you learned something. I hope you had fun. I'm Dr. Laurie McCauley. I hope you enjoyed the whole series. And we'll see you next time. Take care.